Well, howdy and welcome, Virtual Reality Medic here. Wonderful question that came in about Tetralogy of Fallot. Now, that's cardiac related. We're going to talk about that here in just a second. But you'll notice that we're in a pediatric intensive care unit. You can take a look around. We're in the pediatric intensive care unit. And the reason that we're in the pediatric intensive care unit is because Tetralogy of Fallot is going to be found in infants, okay? Could be neonatal, so brand new. Could be, still within a month or two of birth, but it's generally going to be found relatively quickly because it is a congenital heart defect, okay? So looking at the heart here, I want to orient you to what we're looking at. Remember, when we're looking at something, we're always, the right side is the patient's right or the mannequin's right, and the left side is the patient's left or the mannequin's left. So in this case, the left side of the heart is over here. This is the left, right over here. This is the left ventricle. This is the right ventricle, okay? So right ventricle, left ventricle. All right, so one of the first things that you would see in a Tetralogy of Fallot case is that there's a ventricular septal defect. So the septum, this center portion that's separating the left and the right ventricle, there's a defect in it. So in other words, blood flow is going between the left ventricle and the right ventricle, okay? Ventricular septal defect. One of the things that that's going to cause is that's going to cause a lot of increased pressure and backflow on the pulmonary valve here, okay? So to orient you to the valves, it's TPMA, so T, the tricuspid valve, P, the pulmonary valve, M, the mitral valve, and A, the aortic valve. And we'll see the aortic valve here in just a second. Okay, so TPMA. So that pulmonary valve right there will become hardened, stenotic, it will narrow down. And so then in that case as well, what's going to happen is the aortic valve, okay, the aorta itself is going to override in terms of blood flow and start pulling blood from the right ventricle into the left ventricle and then out to the body. If you remember, when we talk about anatomy, that aortic valve, that's where all of the blood is going to go to then go out to the body. It's going to go through that valve. Well, the aorta kind of comes down, pulls down in a little bit here, and overrides the blood flow now going even to the lungs, right? The pulmonary arteries go out and they go to the lungs. Well, so what's happening is the deoxygenated blood that's coming back from the body is going to come back here into the right ventricle, and instead of going out through the pulmonary arteries to the lungs, it's going to come across that ventricular septal defect there, and it's going to go up and through and into the aorta. And then it's going to pump out to the body. So you can imagine what's going to happen is deoxygenated blood combines with oxygenated blood. We kind of call it purple blood because blue blood is the deoxygenated blood. It's not really blue, but that's what we classify it. And then red blood is the oxygenated blood that's going to go out to the body. Well, these two are going to kind of it's going to cross, and you're going to get deoxygenated blood combined with oxygenated blood. The other thing that's going to happen is there's a lot of increased pressure on the right ventricle here, and the right ventricular wall is bigger. Okay, so that's what's going on. We've got a bigger right ventricular wall, okay? And that affects the amount of blood flow coming back to the heart. We term that as preload. Maybe we'll talk about preload, afterload, blood flow, Starling effect, all of that kind of stuff coming up in future videos here. And so we've got the larger right ventricle, the ventricular septal defect. We've got pulmonary valve stenosis, okay? So in that pulmonary valve, there's some stenosis. And then the aorta overrides, and that aorta starts to pull blood, deoxygenated blood, across that ventricular septal defect and up and out to the body. So you get a mix of oxygenated blood, deoxygenated blood, and that will cause that infant to start to turn a bluish color. Extremely scary. It's not the only reason that those kind of things happen, but it is definitely one. It is very rare. It is very, very rare. But if there's anything, maybe you're suspecting something like that, immediately go to the emergency room and get in touch with a pediatric cardiologist, and you can see if that's what's going on. Not giving any medical advice, but you know what? It's always best if something's going on, go get some help. Go find out what's going on, and don't be afraid to come to the experts. So, all right. Well, hey, that's Tetralogy of Fallot. Thanks for that excellent question. Wonderful, wonderful question. And I'm going to go see what's going on with the baby over here. I think maybe I can help. Hi. How's? Uh-oh. Okay. Yeah. That's not good. Hey, where's the nurse? Where's